Good time of the day. We got an interesting question whether there is such thing as food addiction, whether it's real, and what foods, and if it's real, what foods are most addictive.
Hi, I've been coming to see Dr. Mogolin for about 2 months now, and in the last few weeks I've lost 15 pounds because of my pain regimen that I'm on. I'm able to exercise. I have started eating better and I'm getting around. I'm very much more mobile and I'm working a full-time job and my life is great right now.
Hi, my name's Sherry Hall, and since I've been coming here, I've been able to get up, do my dishes, do other things that I was never able to do until I started seeing Dr. Margolin. And today I am 138 pounds lighter, and I'm using the walker, and I'm not in a wheelchair, and I'm tickled to death.
Hi, I'm Gary. I wanted to talk to you just a few seconds today to tell you what I've been through and how Dr. Mongolian has helped me. If you're in pain, you need to come here. I've been to several doctors. This is the first place that I have found relief. I hope to meet you out in the waiting room someday.
Hi, my name is Rosemary Dameron. I've been coming to Dr. Margolian's office for pain. He has helped me tremendously. I can get around better than I have been in a couple of years. I'd recommend him to anyone.
Well, there are two components to this question. First, is there such thing as addiction to food? And secondly, can this addiction be dangerous? Why the distinction is important? For example, we talked about coffee. There are opinions that coffee drinker may show signs of addiction, withdrawal, tolerance. We discussed it in addiction videos, like, those people standing before, in line in coffee shop in the morning before work, or doing it at home. It's like almost like a fix in the morning. So they need it to function, but however, it's not dangerous. It doesn't interfere with their function. We don't see that people trying to get coffee, breaking into coffee shop, or, doing something despite harm. So that may or may not be an addiction or dependence, but it's not dangerous. How the question is, can food addiction have consequences? So first, why there is a possibility of food addiction. Generally, addiction is related to a transmitter called dopamine, particularly D2 receptor. As early as 2013, there were publications that actually showed that some foods can activate dopamine and can activate dopamine in the same areas of the brain, which is related to the classic addictive substances. In our practice, we performed a survey some time ago. We used 8 questions for the survey of classic addiction or addictive behavior, mood changes, tolerance, withdrawal, consumption more than initially thought, people trying to reduce consumption, food, but they can't stop consuming food if they fail to reduce, spending substantial amount of time, more than 2 hours, in trying to get foods, reduce activity, health and mental problems. And we offered, those were 8 questions, and we offered options: chocolate, cheese, meat, and others. So we gave pain patients these questionnaires, and we asked if they have any of those problems with these foods. And we got interesting results. we compared, correlated, we got about 880 answers from 110 patients. And what basically transpired is that first there might be a correlation between addictive treatment of food and something called NARC score. NARC score is a score that we use to quantify overdose risk. Each paying patient gets the score, and we pull it practically for every patient, almost every visit, from the state database called ORS, Prescription Monitoring Database. So it's validated by the state, which to some extent can be used to quantify the risk, low, moderate, high risk. And we saw that there is a correlation between food addiction and NARC score. And interestingly, interesting results. The highest correlation between food groups and NARC score came from question 5 out of 8 questions we discussed. Try to reduce, stop eating food, but failed. So people who have tendency to binge on food and they try to stop and they fail, they have potential for having higher overdose risk. And question 7, reduce other activities, social, family time for food, which is similar for other substances. Interestingly, we found that the highest NARC score, the highest risk was in the group of people who crave chocolate, meaning sugar. We also had high correlation for cheese and meat. This is preliminary data. Interestingly, meat was associated with the highest absolute NARC score. Other foods reported with high frequency were coffee, sodas, and sweets, which all basically comes to the assumption, to the thesis that sugar can be an addictive substance, and cheese also showed pretty high correlation. So I don't think it's approved, but it's an observation suggesting that there is such thing as food addiction. We should be aware of that. And not only it exists, it correlates with the NARC score, it correlates with the overdose risk. And therefore, we should be careful with what we eat and avoid addictive food substances. Thank you so much for this question.